Okay, in this video I will now like to talk about special population group. This special population group may have a medical condition or injury that needs to be considered as there will be restrictions. They will be required to be constantly assessed throughout the session to make sure they are not exerting themselves in any way. Now we will go through some different conditions and what alternatives we have for those. Okay, first one, we have a client with a high blood pressure or hypertension, which means that blood is pumping out at a higher rate than normal throughout the arteries. With that in mind, the alternatives are, for example, push-ups can be done on an incline or a wall to keep the head above the heart. Lighter weights can be used, but with higher reps. The chest press can be performed on an incline. Also, a warm-up and cool down will also help avoid a sudden rise in blood pressure. Exercises to avoid are lifting maximum weight, raising feet above the head because it puts pressure on the heart, and lifting weight above the head. Now the clients with the lower back pain. The lower back is made up of tendons, muscles and soft tissues, and you have highly sensitive nerves that travel from your lower back to your feet. You also have small and complex joints and spinal discs. If you have an irritation or a problem in any of these areas, that can cause a back pain. Alternatives for that, for example, push-ups on knees instead of toes. Lunges are performed without weights or changed to wall sit. Squats can be performed with the ball as a stabilizer, and planks can be modified to abdominal crunches. Exercises to avoid are sit-ups, leg lifts, burpees, touching toes, box jumps and deadlifts. Now for a client with a knee injury. Common injuries are those of the ligaments, tendons and cartilage tears, which is caused by sudden twists, excess force of knee joints or just general wear and tear. So the alternatives for a client with the knee injuries are, instead of lunges, they can do squats, which will put less strain on the knees. This can be modified further by using a stability ball to make it easier on the knee joints. The leg press is another option, as the machine distributes the weights evenly, and it also has adjustable seat to limit the range. It also allows you to brace your core, which supports your back. It also works the same muscles, which in this case is the glutes maximus. Exercises to avoid are leg extensions and deep squats and lunges. Thank you.